and today I'm going to talk to you about how to gain your patient's trust, which is something that I feel is very important. I started to think about some of the things that make you a good nurse, and I believe that knowing you can be trusted is on top of the list. There are 3 things that I want to share with you today, that is what trust is, being confident, and last but not least, being honest, which is what I believe is something that we should all do every day of our life, not just in our professional career. Webster defines trust as reliance on the integrity, strength, ability, and certainty of a person. Also, trust is defined as being confident in something or someone. I know that trust is something that we all long for, and knowing that you can go to a doctor or a hospital and trust the nurse is very important. Trust is something that starts with a genuine, caring presence. People can usually determine within a few moments if you are a trustworthy person. If you have a genuine presence about yourself while around others, people are more likely to think or believe that you care about them. Also, I believe that trust is an important factor for leaders, or in my case, a nurse. While trust is built over time, it can be easily lost. I believe that some of the ways you can gain a patient's trust is by listening to them, being patient, having good bedside manners, being kind, being honest, being confident, and treating them like they are a person. Because I know that if the patient coming in scared or unsure of something, I would want to do everything in my abilities to help them feel comfort. And to just know that they aren't alone in what they are going through. And the doctors and the nurses are there and willing to help. I also have done some research on patient trust, and I found an interesting article online. In this article, Lydia Scapria talks about, who's an MD, she talks about how important it is to have patient's trust. She says that there are numerous reasons for a patient that a patient might have initial mistrust. They might have had bad experiences with doctors or nurses, or they might have been given incorrect information about you. But to gain patient's trust, Scapria offers these practical suggestions. The most important thing is to show interest in the person. Let the patient know that you have reviewed the records and that you understand the diagnosis and the pathology. Set the agenda to work with the patient, aligning your expectations with those of the patient. Only then discuss the treatment options. I find this advice very important because it is very true. The patient needs to know that he or she is cared about, and that you are being sincere when you're talking to them. I also read in another article that I found online, written by Dr. Steve Pearson. He talks about how trust is very important to the nurse and to the patient as well. He continues to say that patients need to know that no matter what the circumstance or how fast-paced the situation can become, the patient can trust the nurse or doctor. Dr. Pearson says, trust is a defining element in any interpersonal relationship, but is particularly central to the patient-physician relationship. Although evidence shows that the majority of the patients continue to trust physicians to act in their best interest, concern is growing that the rapid and far-reaching changes in the healthcare system have placed great pressure on that trust, and it may be undetermining it. I couldn't agree more with this quote. I think that trust could be undetermined very quickly, but definitely doesn't need to be taken advantage of. Secondly, I believe that being confident with a patient is a very good way to gain a patient's trust. If a patient sees that you are confident in what you're doing, this will put them more at ease and more willing to trust you. I know that if I were at a doctor's office and the nurse was unsure of how things worked or unsure of how to speak to me with confidence, I would have a hard time trusting what he or she was telling me, no matter how important it was. One way to show confidence with a patient is by answering any questions they may have, and be sure of what you're talking about. If you are uncertain of what's being asked of you, be honest with the patient and let them know you aren't sure, but you'll check with a doctor or another nurse to find out. I can honestly say that I know that I'd rather hear my nurse say, "Hold on just a second and I'll find out for sure," rather than making something up or stumbling on words because of uncertainty. Another way to be confident with a patient is to walk in and walk out of the room with your head held high and a smile on your face. Not only will that show confidence, that shows them that you are glad to see them and that you really do care about them. Lastly, I believe that being honest with a patient and with everyone that you come in contact with is a very important matter, and it also plays an important part in patient trust. If a patient has something that could be life-changing and needs to know, give the message with honesty and with boldness, yet tenderness. Even if the news isn't life-changing and the patient just has the flu, be honest with them and explain the details with them. If they have further questions that you aren't able to answer, ask for permission to bring the doctor, which may or may not already be in the room with you, so that the situation can be explained better. Don't be afraid to tell the patient that you are unsure or that someone can explain something better, because we all need help sometimes, and I know that if honesty is one of our prime focuses, the patient will be more understanding and will trust that you are making good decisions and that you know what you are talking about when it comes to the health and situation going on. This is how I believe that a patient's trust can be gained and why I feel it's important. Thank you so much for your time.